Good morning. Myself Varun Kumar, staff, SNS College of Physiotherapy. Today we will see about the topic called evaluation of physical dysfunction. Definition of physical dysfunction. Usually, the physical dysfunction occurs in various conditions, especially in the neurological conditions. So, in that, initially we can see the physical dysfunction in the spinal cord injury patients. The spinal cord injury. So, definition of the spinal cord injury: there may be a damage or injury occurs in the spinal cord level, either cervical or lumbar or thoracic level, which causing the loss of motor, sensory, and then the autonomical function below the injury occurred area of the spinal cord. So the clinical features depends upon the area involved. So either there can be a complete cord injury or incomplete cord injury. The features may be changed. Then there will be a motor paralysis, sensory loss, bladder or bowel dysfunctions. So the complications presents pressure source spasticity and then the contractures. So evaluation. So the evaluation of the spinal cord injury, it may be through the ACR scale or the motor and sensory testing or the functional independence measurement scale. So the rehab approaches. So rehab approaches mainly focusing on the acute stages. We can focus on the positioning, chest physiotherapy for preventing the lung secretions, prevention of the bed sores. In subacute, we can go with the range of motion exercises, strengthening exercises, wheelchair skills. In community-based one, we can go with the gait training with the orthotics and then the occasional training. So example, T12 fracture leads to the paraplegia. We can go with the wheelchair independence program. Then for CVA, so in that CVA, how we can evaluate the physical dysfunction. So CVA, we can evaluate, definition is the sudden loss of brain function due to the vascular causes. The clinical features includes the hemiplegia, aphasia, neglect, spasticity, sensory loss. So evaluation through the motor assessments, then functional assessments, and then the balance skills. So rehab approaches focusing majorly on the early mobilization, positioning, range of motion exercises, facilitation of the movement, gait training with the aids, speech and occupational therapist. So the example, left MCA stroke leads to the right hemiplegia. Then we can go with the cane assisted gait training. Then another condition called a cerebral palsy. So the group of non-progressive motor disorder caused by the brain damage is called as the cerebral palsy. So types of the cerebral palsy includes the spastic CP, attitoid CP, ataxic CP, and then a mixed CP. So the clinical features involves there may be abnormal tone, delayed milestone, there may be a poor balance or coordination, and then associated reactions, there may be a seizures, speech problems, and then a mental retardation. So evaluation. So the gross motor function classification system, then developmental milestone helps to evaluate. Then rehab approaches stretching for spasticity, strengthening for the weak muscles, gait training with the orthosis. So example, spastic diplegia leads to the walker assisted ambulation. So next kind of condition called arthritis. So definition, there will be inflammation of the joints leading to the pain, stiffness, and then a deformity. So types may be osteoarthritis or rheumatoid arthritis or juvenile arthritis. So features involves pain, swelling, stiffness, and then the deformity. Then there will be reduced range of motion. So evaluation by means of evaluating through joint range of motion, muscle strength, and then the functional status, or we can go with the OMAC index. Then rehab approaches usually involves with the pain modalities like TENS or heat therapy. Then we can go with the joint protection technique, strengthening exercises, hydrotherapy, splints, and then adaptive devices. So example, rheumatoid arthritis with the hand deformities leads to the hand functioning training. So muscle dystrophy is the one of the condition which leads to the inherited progressive muscle wasting, where the progression may be go for the progressive weakness. It ends up in the Gover's sign, and then there may be presence of contractures. So in evaluation, it can be used by means of the MMT. Then we can go for the functional status. In rehab approaches, we can go with the maintaining the mobility exercises, then strengthening of unaffected muscles, then respiratory physiotherapy, then we can go with the wheelchair adoption in later stages. So example, 10-year-old boy with touch and muscular dystrophy leads to the wheelchair mobility training. So Hansen diseases are also called as the leprosy. It is due to the Mycobacterium leprae, which affecting the skin, nerves, and then the eyes. So the features involve nerve thickening, sensory loss, ulcers, deformities. Evaluation through the sensory testing and then the motor testing of the small muscles of hand or foot. In rehab approaches, we focusing on the protective the foot wears and then the splints, ulcers, the care, ulcer care and prevention. Then we can go with the muscle re-education, tendon transfer training. So example, claw and tendon transfer leads to the hand re-education exercises. So peripheral nerve lesions, injuries to the peripheral nerve leads to the loss of motor sensory function. The features depends upon the nerve. There may be a features. It may be evaluation through the muscle MMT, muscle manual muscle testing. In rehab approaches, there may be a sprinting for hand function or muscle re-education or sensory re-education. Then we can, in example, for radial nerve palsy, we can go with the cock-up splint and then a strengthening exercise. Then fracture rehabilitation. So clinical features involve the pain, swelling, restricted movements. There may be evaluation through the range of motion. Rehab approaches through the pain and edema control, post immobilization or immobilization strengthening exercises. Then functional training and return to activity. Then cardiorespiratory dysfunction. So cardiorespiratory dysfunction due to the functional limitation due to the cardiac or pulmonary diseases. So common conditions involve COPD, asthma, post-CABG or heart failure. It may be evaluation through the 6-minute walk test or VO2 max or spirometry. So then work scale for exercise. So rehab approaches involve breathing exercise, airway clearance, aerobic training. For post example, there may be a post MI patient, we can go with a treadmill walking under supervision. So general principles of evaluations. In that principles of evaluation, we have to know about the history taking, where the onset, progression, limitations. Then in physical examination, we can go with the range of motion, strength, tone, balance, and coordination. Then functional assessment, we can go with the ideal performance. In outcome measures, we can use the FIM or film score or bottleneck score or disease specific scales. So these are used to the evaluation of the various conditions. So these are all about the evaluation of the conditions through rehabilitation. Thank you.